So, डायरेक्ट एंटीरियर अप्रोच हिप रिप्लेसमेंट की काफ़ी सारी इन्फॉर्मेशन अवेलेबल है ऑनलाइन, कुछ सही और कुछ गलत। हम कोशिश करेंगे इन दिस रैपिड फायर हम एक या दो वर्ड में आपके क्वेश्चंस के आंसर्स दे पाएं। लेट्स गो।
You walk on the same day.
Yes, you walk on the same day of surgery.
You can sit cross-legged.
Yes, true. You can sit cross-legged after a direct anterior approach to hip replacement.
Robotic is always better.
No, robotic is not always better. Please ask your consultants and your surgeons if robotic is the right surgical procedure for you.
DA has fewer dislocations.
Correct, because we don't cut any muscles in the direct anterior approach, risk of dislocation is far lower than any other surgical approach.
Recovery takes 3 months.
Absolutely wrong. You start walking on the same day, you climb stairs on the next day, you go home and start doing your routine activities immediately after the surgery. You go back to work whenever you're comfortable. Generally, the patients start doing it about 2 to 3 weeks after surgery. Direct anterior approach is a game changer for total hip replacement surgeries, and we're just getting started.